last night we were clapping for all the NHS workers, key workers, care workers, everyone from the volunteers to doctors and nurses. And this has now become a regular weekly ritual on a Thursday evening at 8 p.m. We all come out of our, well, not literally out of our houses, but, stand in front of our front doors or leaning out of flat windows. You can see communities and neighbours just getting together and making a huge noise, banging pots, pans, whatever comes to mind is and readily accessible. You can hear all kinds of sort of contraptions being used, but it is great because it does kind of elevate that community spirit and neighborliness, which we really need. It's actually rather comforting because I remember the first week of lockdown, it was quite unusual to adapt to this kind of imposed isolation, and other than fraternizing with household members, there's very little engagement with others on a social basis until this lockdown is lifted. And especially in urban cities, and which I've sort of lived in most of my life, it's difficult to always really familiarize yourself with neighbors. And the great thing about us coming out for clapping for key workers, NHS workers, volunteers on a Thursday evening is that we get to see our neighbours, and it's great. We're all saying hi and just chatting across the garden gate. So it's been a real pleasure to find that even though we have social distancing, it still had a positive impact. In actual fact, inadvertently, we've had the complete dichotomy with regards to it bringing us closer to our local neighbours. And there's been offers of, if you need anything, because we can see there's a couple of more sort of, shall we call them, older folk who may need supplies, and so offers of help and assistance have been proffered to those that we've been able to visually identify as may require assistance. But it's all been very congenial and fun, and it's great for the kids as well to participate in this, and hopefully, who knows, if the lockdown is lifted before the onset of summer in June, July, we'll probably have some more, or an increase in numbers of street party applications with the local councils, and more sort of community-based activities which we can all sort of engage in and maintain that community spirit and that kind of social fabric, which is so essential and has really been lost compared to generations previously. We're so sort of consumed with going to work and working the 9 to 5 regular job, and it's always very busy, even in the evenings and weekends. So it's nice to just kind of find the opportunity and the time to re-engage with local neighbours. Now, really what this episode was about is talking about PPE, personal protection equipment. It's very difficult to watch the news now on a regular basis. It's been quite a few weeks where it's been a glaring issue in the media concerning PPE and major shortages, it's obviously an imperative for health workers and all other frontline key workers, from carers in working or healthcare assistants or others working in care homes or in the healthcare system or social care system. It's difficult, forget to differentiate between the two, but it's important for all these key workers to have this equipment in order to ensure that, you know, they mitigate the risk, not only to themselves but to their clients and patients, not to put them at risk. And we obviously, nurses and doctors, they will be in close proximity for prolonged periods of time in intensive care units, and this is where I've been absolutely flabbergasted to still be hearing stories or pleas of national media from hospital doctors, nurses, who that's the only way they can reach out to explain that they're still concerned about the current PPE shortages. And, you know, of course, we know that many governments have been purchasing in vast quantities, and there is a huge demand globally. Whether the supply and the logistics of distribution is difficult to really coordinate to meet the demand. But I still wonder, can't help feeling that this insufficient planning and just the fact that there's such a shortfall of PPE equipment when we have, especially in Western European countries and other more developed nations in the world, and also, well, in actual fact, in developed countries like India, you have manufacturers and factories where really we could have planned perhaps a lot sooner to ensure the manufacture of gowns and goggles, which now, and medical masks, respirators, you know, coordinating partnerships with with other companies and businesses to ensure we can produce these when we've started to find the cases of COVID-19 patients rising, and the necessity became even more urgent to ensure that we were able to the governments were able to supply the gowns, goggles, and all the other sort of paraphernalia with PPE, which is required to keep them safe. It's also ironic, I recall, that the World Health Organization, WHO, there is a high degree of transparency, admittedly, acknowledging from them that they were recommending the so-called rational use of PPE, which is acknowledging the fact that it was anticipated, even, you know, up to sort of nearly 2 months ago, that there would be a huge demand which could not be met through supply of the PPE, and inevitably there will be a current PPE shortage. Now, the reason why this is such an important issue, and I think that a lot of governments and leaders will be judged upon this, is the outcome, the significant outcome from the shortages of PPE, and will inadvertently, well, directly impact many different areas. We've seen an increase in the UK of deaths in care homes, where again we're hearing stories of home owners announcing that they're worried. They've only, they're down to their last supply, box or whatever of personal protection equipment, and really concerned about being able to procure the necessary PPE for their workers. Again, there have been concerns raised by the BMA, which is the professional body, represents NHS workers, British Medical Association for doctors, declaring as well that the lack of PPE has caused doctors in certain cases to improvise. I remember earlier, it was really right from the onset, very, very early on, when numbers did start to increase of people having contracted COVID-19 or the coronavirus. There were news items that certain GPs and doctors had been compelled to improvise and buy sealed masks from garages and DIY stores, the ones which builders tend to wear. But again, those are absolutely useless, really, and won't fundamentally provide them with the necessary protection which they do require. I mean, obviously, the initial priority was to provide this equipment for those healthcare workers directly treating, COVID-19 patients, and we're not just talking about gloves and masks, but obviously the full paraphernalia from, the respiratory masks, gowns, aprons, obviously the eye protection, whether it's goggles or a face shield. So there's a huge amount of PPE gear, shall we say, that they need to wear, and I believe it's immediately disposed of, discarded once they have been in, after one single use. So it's imperative that this gets replenished on a frequent and consistent basis, and inevitably with lockdown there has been supply chains have been disrupted, and there've probably been incidences of panic buying in certain regions, and with transport sector being shut down as well, and restrictions on, we hear about logistical problems, with regards to, I suppose, restrictions on exports and checking the quality as well of the products. Again, there's a whole gamut of shall we say, obstacles, which need to be alleviated as quickly as possible to ensure that we're not putting people's key workers' lives unnecessarily at risk. And I think the patience is wearing extremely thin. I know, as someone who's been, as a viewer, who's been watching or reading the media, it's difficult for me to stomach at this stage when we're weeks in and we've had epicenters in Europe, from Italy, Spain, France, where we have seen the consequences of coronavirus with the deaths of doctors and nurses and other key workers, and we've had the same in the UK as well. So it's difficult to stomach that we have frontline staff dying, and it's hard to obviously determine whether or not this has been a result of having inadequate protective equipment that they contracted the COVID virus. It's difficult to determine, obviously, when and how they contracted the virus, but will always be this great, huge cloud overhanging whether or not that one fatality could have been prevented with adequate PPE equipment, supplied earlier. And it's not even that. It's also the case that we all know that we were entering a very dangerous period, and doctors and nurses groups, others as well, representatives from other, social care, healthcare, and other key worker organisations and representative bodies did tackle governments, and to respond and, urgently get these supplies of PPE to mitigate these unacceptable risks of contracting the virus. Now, the travesty of the situation is that some doctors, which in order to safeguard their health and also of their families, are now fearing, considering leaving the NHS, or perhaps, looking to refuse, as in the case of the nursing organisation in the UK was recommending that nurses, the Royal College of Nursing, which is the representative body for the 400,000 nurses in Britain, UK, who actually had to formally say that their responsibility is to ensure that frontline nursing staff have the adequate equipment, and if these they don't have the adequate protection, then they will need to obviously not be put in a predicament, that the nurses, between choosing to do their job and their own personal safety, which consequently would mean that if the nurses were unable to have the adequate PPE equipment, then they wouldn't be compelled to administer treatment to a COVID-19 patient, because obviously, and again, we shouldn't be putting the healthcare workers, nurses, doctors, and others, key workers, in this kind of situation of jeopardy, and obviously the many will be, acknowledging that they shouldn't be expected to take unacceptable risks to their own personal health. I think that personally, I feel the one thing about this global coronavirus pandemic, one of the outcomes will be that countries and governments will be able to assess and review their response, and it will highlight weaknesses so that they will be able to coordinate a more effective response in the future should any sort of similar endemic occur, or any sort of other public national health emergency, which they will now be able to, because to formulate some sort of a plan. Because the one thing that has been highlighted, it's no longer hypothetical whether, we will have virus pandemics occurring. It's something that is inevitable will occur. We've had a few situations, pandemics within the last 100 years, but it's just to ensure that, governments are properly prepared with their response and not feel overwhelmed with all the various issues which have been highlighted and arisen with the current pandemic outbreak, which has been probably the most severe since the Second World War for governments to contend with. And lastly, I'm just going to finish off. The severity of the threat has come home, really been highlighted, because there's been an incident today, well, not an incident, it's just come to light that a husband and pregnant wife, both NHS doctors, National Health Service doctors in the UK, are going to be mounting a legal case against the government over the lack of PPE. Both have acknowledged that they have been personally exposed to patients with coronavirus, and I think their argument is that they claim that the government's guidance is not good enough or substantial enough to ensure proper protection to frontline NHS workers, because it's been recently revised, and that their government's revised guidelines are not uniform across various NHS trusts, and it's putting again them in an unimaginable situation where they need to really don't feel that they have the correct protective equipment to do their jobs as doctors. So we'll see how this hopefully manufacturers, will be able to meet the huge demand for PPE globally, not just in the UK, but everywhere, because it is almost like gold dust now. It's something that really is invaluable, because it will save lives, and frontline key workers do need this essential equipment as soon as possible. Thank you for tuning in to today's episode. You can subscribe to the Commons podcast via iTunes, Spotify, and other major providers.